did have it in front of me, the cost of having option A, which is Poole as the major emergency hospital and Bournemouth as the planned hospital, is going to cost 189 million to do that change. Bournemouth, the major emergency hospital, and Poole as the planned hospital will cost 147 million to make that change. The gap is 158 million. So they're spending more money to save money.
Oh.
Okay, and sustainability and transformation plans, I'm sorry but it does get on my nerves, don't have to happen. There are cuts to the NHS that do not need to happen. There are, you know, Anthony has found out about the CCG, the staffing, the cost of the staffing, how many people there are, these are new things that happen to us, imposed on us in 2013. CCGs didn't have to happen, 300 staff, I can't remember the figures. How much are they getting paid? You know, if we're looking at cuts, did we need them in the first place? That's my rant over. Just gets on my nerves. The cuts don't need to be made. Okay, so we found out, because we were really busy with the Save Our Beds campaign, as you know, with the shop, and I was helping Julian out, and halfway through, we found out about another consultation, which I'm not sure a lot of people know about, mental health. So really, really bad for the CCG to overlap one consultation with another. It's almost like they snuck it in. I didn't say that. So the mental health consultation was supposedly improving mental health services to Dorset and looking at what they've got already and how they can make it better, which on the face of it does sound really good. But when I started to look at what we've got on the map now, it's a bit different because Save Our Beds, we've already got the hospital, we've already got the beds, they're going to be asking, they're trying to take a service away. With mental health, we've got nothing in North Dorset, so they're not taking anything away, but what really upset me was, here's a consultation, there's a chance here to actually look at what you've got, look at what's missing, and try, well, parity of esteem, which is what they talk about, giving mental health and physical health the same value, because they are interlinked. And when I looked through the consultation document, it became very apparent. I don't know if you can see this, but this is my scribbled on version. 0 services in North Dorset. So you actually draw a line, well, there's a pen there. All the services are in Dorchester, Poole and Weymouth. And there's a possibility that Weymouth is going to lose 15 beds from the Linden unit. So, okay, we've got nothing. So, save our mental health services. I had the CCG saying to me, well, what do you mean save our services? What services are you saving? Well, actually, it's save our mental health. We haven't got anything here. Just because we've got nothing doesn't mean that when you do a consultation, you leave nothing still in place. So I looked into it further, and I have produced a report, and if anybody wants a copy of this, it does actually explain quite intricately, and I've challenged the CCG on the inequality of service provision that they want to put into Dorset per se as a whole. They've concentrated on the conurbations because they've gone from the records of the serious mental illness register, probably as part things that don't really mean anything, but people that are registered on this SMI, they call it, and they've gone for 66% of the population in Dorset. Those people on that register come from Poole, Bournemouth and Dorchester. Therefore, we're going to put the services in Poole, Bournemouth and Dorchester. Yeah. Now, I don't know if anybody has heard about the Crisis Care Concordat, which the government brought out. It's not law, it's just guidelines, but it's supposed to be that we don't actually have to travel so far if we need help with our mental health. When we talk about mental health, that can be anything from low mood, low self-esteem, depression, all to if somebody's lost a limb and they used to go running and they can't anymore. That's what I say about the physical and the mental being linked together. Now, if you've got to go, how long does it take us to get to Dorchester from here? An hour? If you've got to go an hour to visit someone that's getting over a mental health illness where they've had to have been put into an inpatient unit, and then, you know, you've got to bring them home for the day and take them back again. That's a long time. That's a long time. We need to be able to access services closer to home. What Dorset seem to be doing is going in the opposite direction to what is nationally happening. So what they propose is to take the beds from the Linden unit, the 15 beds in Weymouth, and add beds to St Anne's in Poole and the Forston Clinic in Dorchester. That's essentially building institutions, whereas the rest of the country, nationally, we're talking about smaller units in closer to home, so it's not such big institutions. So I've challenged them on those issues. I've also challenged them on rural proofing mental health, because there is this inequality of the rural services versus the urban services. And when we look at figures on population, the population of Shaftesbury and Gillingham actually is an amount of people that are in Dorchester. So completely left us out just because we're little villages in the north and we don't really matter. So when I put the report to them, if I hadn't have done this, they would have just carried on, and regardless. They have actually put some mention of my report in their responses, the questionnaires. Julian arranged so that we could have the shop until the end of March, which was fantastic. If we hadn't have had that, nobody would even known about the mental health consultation. Everybody that we asked didn't have a clue. It didn't really have the same pull factor as taking the beds. As I said earlier, you've got the hospital there, they want to take your beds away. That's completely horrendous. But with mental health, we haven't got anything. They're reviewing it, and then they're going to give us nothing. So that's almost as bad, I think. But anyway, the main points in this report will address the inequalities in mental health. Now, easier to see it on this. So the pink circle is Shaftesbury in the centre, and that's the area around it. Absolutely no services, as you can see. The yellow ones is where all the services are going to be. They wanted to put one of the new services, community front room, which is supposed to be for early intervention, into Sturmiston Newton. That's still 8-9 miles from us, from Gillingham and Shaftesbury. So they've now reconsidered, only as part of the actions of Save Our Mental Health, to put one of the services in Gillingham or Shaftesbury. But what's really difficult is obviously challenging the CCG to get out this box that it's all got to be in the institutions of St Anne's and Forston, and to get inpatient beds nearer to home. We looked at the example in Bodmin Community Hospital, where they have mental health units inside the hospital. So actually got mental health and physical health together in a community hospital in Bodmin. It's working really well. They're having their first CQC report. I said to the CCG, can we take the beds that are being taken from Weymouth, the Linden unit, and move them into Shaftesbury? That was they haven't come back to me on that. But you see, this would support our hospital as well, because if we had another unit, that's more beds, there's even more of a need for the hospital here. So that's where Julian and I started to sort of interlink a bit more, because obviously it's more, we've seen the decline of the beds, haven't we, from Shaftesbury, where it used to be a 30-bedded unit. Yeah, and now it's like, oh, what are they saying? Things like they're not used, it's underused, and things like that. Yeah. So I was trying to really highlight the fact that we could do with a mental health unit if we're going to be moving beds, and that was that. So anyway, I've waffled, but the long and the short of it is the inequalities in the urban and rural, and highlighting the fact that people with mental health issues need to be seen closer to home, quicker, and have the services nearer. So this report here really does go in depth into that, and looks at all our area, what's missing and what we need. If you want a copy of this, I can email it to you if anybody wants a copy of it. Okay?
Melanie, thank you very much. I don't think that I would be very surprised if there is anybody in this room who doesn't know somebody who has some element of problems in what is euphemistically called mental health, and it's got so many names that go to it, and we don't